Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for patients and parents. Um, Please remember that these videos are not intended to replace visits to your doctor's office. If we can be of assistance here, we can be reached at our phone number here, 775-359-7111. And don't forget to like us on Facebook at sparkspeds.nv, because we would love to see you there. Today, our video is a little bit different of a topic from many. This is for parents and family members, but the topic is a little bit different from ones we've done in the past. This one comes to me actually by request from a friend and some mutual friends who are involved in some emergency room care in another part of the country. And it's a question I actually hear a lot. People joke about it a lot at parties. And the specific question is, what is going on with penile fracture? So I thought I would take the time to review male genital anatomy, at least with regards to fracture of the penis and some of the more traumatic disorders that can happen. They are common, um, and they're a source of concern for a lot of males. Both adults and children, because children can get injured and these injuries persist into adulthood. So let's take a look at what is actually going on. So, whoops, let's turn this off. And, whoops, there we go. Okay. So, the penis is composed of several structures. And first and foremost, oops, this is not shaping up quite the way we'd like. Let me dispel the myth that the penis is a muscle. It is not. So if we take a cross-section of the penis, we're going to see something that looks like this. So if we look at it longitudinally, we see something that looks like this. In an uncircumcised male and in a circumcised male, there will be some additional skin. Here. Okay. So if we take and look straight down on that, what we get is something that looks like this. Okay. And my computer is running really slow here. And this should actually come much closer here. And we're just going to clean this up a little bit because my artwork isn't the greatest. Okay, so that looks pretty good. So what are these anatomic structures that we're looking at? Okay, well this one right here, and there's two of them, are called corpus cavernosa. And let me just adjust the size of my font here. So you have the two corpus cavernosa there, and then we have this structure at the bottom, referred to as the corpus spongiosa. Okay. In the center of the corpus spongiosa is this red structure. This red structure is actually an opening, and that is the urethra. Okay, the urethra is the opening through which, or is the tube through which urine passes, running from the bladder to the outside world. Okay, then, probably the most important to this discussion part of anatomy are these two structures right here. There is a very thin membrane that runs around all three corpora, okay, called either deep or buccal fascia. You can think of it as a ligament. Oops. Let's do that again. Alright, so that's deep or buccal fascia. And then around each of the corpora is another very thin membrane called the tunica albuginea. Okay, or white membrane. Let's try that again. Okay. One last time. There we go. Okay, so the tunica albuginea. And there's three of those tunicas that run around each corpus. Alright, so what is the corpus cavernosa? Well, the corpus cavernosa is a blood-filled sinus, so it's just a sinusoidal area that can fill with blood. There are vessels that run through this, okay, some arteries. So the two penile arteries run through this. And in order to result in erection, what happens is those veins, there are some veins that drain it running laterally, and those veins get compressed, and the arteries relax, resulting in the sinusoids here in the corpus cavernosa filling with blood, and to a lesser point the corpus spongiosa. You don't want the corpus spongiosa to completely fill with blood, because if it fills with too much blood and becomes too rigid, then it would constrict the urethra, and that would prevent ejaculation. So all three of these fill with blood. The tunica albuginea, which is a membrane that goes around this, holds everything together and becomes rigid and taut. All right, and then to prevent bowstringing, and give you an idea of what bowstringing looks like. I mean, if you think of like a bow and arrow bow, we're trying to avoid this scenario here. So to prevent that, you have this outer membrane called Buck's fascia. Okay, and then there is a small piece of Buck's fascia that actually goes across here, and that's referred to as the intercavernous septum of deep fascia, or of Buck's fascia. And the reason it goes across here is specifically it misses the corpus spongiosa, and so when things tighten up, you don't compress the corpus spongiosa and compress the urethra. So what happens in penile fractures? Well, you can imagine the activities involved in that, but anatomically is what we really want to discuss here. And it's one of a couple of things, depending on exactly what's happening. In the minorist course, you can just fracture the deep fascia. So a small tear here. And that's easy to fix. A urologist can go in and just suture that. Problem solved. In a more common situation, what you fracture is the entire corpus cavernosa, so you disrupt the sinusoids here and the tunica albuginea. So this whole, and usually it'll be one side or the other, not both, but it could be both sides. And when that happens, there's a great deal of hemorrhaging, because this is a blood-filled sinusoid. And it needs to be stitched back together, and the tunica albuginea stitched back together. Okay. In children, more common is going to be corpus spongiosa disruption. And you get this from straddle injuries. So you're riding a bicycle, fall off the bicycle, hit the crossbar, and you tear or fracture across here. This also fractures the urethra. So what you'll notice with this is when the patient urinates, then urine collects underneath this deep fascia, and it'll collect all the way down into the scrotum and then track up onto the abdominal wall as well, because you have urethral transection. Okay, or we can sometimes see this with falls, um, deceleration injuries, but the more common thing is straddle injuries. Okay, these up here are more sex acts injuries. These are straddle injuries, typically. Nothing in this world is 100%, but that's where these often will come from. Again, the urologist can repair this. Corpus spongiosa fractures are a little more complicated, because you got to make sure that the urethra is intact and that you don't wind up with strictures of the urethra, because you need to be able to pass urine and then later seminal fluid through that. And if you have stricture, that can create problems. So the question then comes up, what causes the penis sometimes to curve to the side? And so that is a situation that looks something like this. Okay, in an uncircumcised male and in a circumcised male, there will be foreskin. Okay, this is a disorder known as Peyronie's disease. And the question is, what is the cause of that? Coming back up here to our cross-sectional anatomy, the sinusoids, there's any of a number of things, but either the sinusoids here or the arteries that fill the sinusoids can become constricted from something. All right, so we'll use kind of a reddish thing here to draw in sites of constriction, or again, the artery becomes obstructed. What sorts of things will obstruct an artery? Blood clots, if you have a clotting disorder, not very commonly. Cholesterol plaques in atherosclerotic heart disease. So just like you can compress the blood vessels in and around the heart, impairing blood flow to the heart, resulting in a heart attack, you can, with cholesterol, fill up the arteries that run through the penis. Doesn't result in death of the tissue, but it results in an inability of the sinusoids on that side to fill. Or you can compress the sinusoids themselves and then they can't fill. Why might you have blood clots? Certain autoimmune disorders can do it, or they can result in fibrosis of the tissue on one side or the other. When that happens, this side doesn't fill with blood, the other side does fill with blood, and the flaccid side will be the side that will be the direction of curve. The artery may or may not be bypassable. The clot may or may not be something that can be reparable, and so it can be permanent. If it results on both sides, what you wind up with is permanent erectile dysfunction. And this kind of erectile dysfunction typically does not respond to something like Viagra or Cialis, because that attempts to dilate the blood vessels here. But if the vessels are completely clogged with cholesterol plaques, there's not much that can be done. So that's a little bit different from a fracture. Okay, now you can result in Peyronie's disease after a fracture, because again you've had to sew these sinusoids, the corpora, back together, and that can result in some scarring, and that scarring can then result in an inability to fill symmetrically with blood, resulting in that curvature. But the fracture itself doesn't result in the curvature. Okay, usually the penis itself is not completely transected, things are intact. When that happens, it is, however, quite painful, because as you can imagine, these sinusoids are well innervated. So, for my friends who work in the ER, I hope this has enlightened you and your other friends as to what's going on with these patients. And kind of solve some of the mystery. But do understand, there's no muscle here. This is all vascular tissue. All right, so arteries, veins, venous plexuses, sinuses, venous sinuses, but no muscle. So I hope this is a little enlightening and explains a few things to you. This is something that comes up a lot, actually. It's a question I get asked a lot by teenagers. So if we can be of assistance, give us a call. Please like us on Facebook. We look forward to seeing you there.